All right, plastic surgery enthusiasts, welcome to another episode of Beauty Confidential. Today, our guest will be Roseanne from Ultimate Weight Loss Solution and her podcast.
The weekly weigh-in with Ro.
Awesome. So, the weekly weigh in with Ro is Roseanne's podcast. She'll be talking about more of kind of like her realm of beauty things, including weight loss, vitamin replacements, exercise, and wellness all over. So, and today, Roseanne is in our office for many years now, doing weight loss, doing wellness, and we've recently introduced also hormone replacement. We provide patients with medical weight loss, including tirzepatide and semaglutide injections. So, the hugely popular drugs that really work for almost everybody. And it's really amazing how many people we've seen that lost a lot of weight. They're really happy, and something that we've always been struggling with. And now we really have an actual solution. It is a medically supervised program, so we do have patients go through the whole protocol. It's not like when you go online and they send you stuff. No, we actually have to see. You have to see a provider, a medical specialist who is going to evaluate your full health history. We do a full blood panel. Make sure that we figure out what is wrong and what we need to treat, and then we'll kind of direct your treatment based on our findings, whether it's appetite suppression, whether it's the semaglutide or tirzepatide, or possibly even hormone replacement. So all of those things are at our office with Roseanne and Lexi RPA. So wanted to introduce Roseanne, and she'll help us kind of break it down and talk about what we do.
Yeah, well, it's on the weight loss side of this. So, yes, I've been here with Dr. Gordiski for almost 15 years now. So, you might have found me back in a closet or in a laundry room or somewhere like that. But wherever we can do weight loss is where we're doing it and getting healthy. So, we've expanded quite a bit now and come together. And we're not in a closet anymore. We've come out. So, what we're doing now is amazing. You've probably heard me before talk about these game changer medications, the semaglutide, which is Ozempic or Wegovy, or tirzepatide, which is the Mounjaro Zepbound. We're carrying those medications. We've got a lot of really cool things that Dr. Gordiski is about to launch on the weight loss side as well as on the supplementation side. So that's coming. Stay tuned. I'll keep you abreast of that, if you will.
So you have to tune into your podcast for that,
Yes,
right?
so I'm going to be doing the weekly weigh-in here coming up with Ro, and it's not just going to be about weight loss. It's going to be really a weekly weigh-in about everything, about life, about how we get to where we are, what we're doing, how to beautify, how to feel good in your own skin, whatever that means for you. So, between Dr. Gordiski, myself, and so many of the providers here, we're here to basically serve and help to make you feel your best and to look your best, so whatever that might mean for you. So I'm really looking forward to this next journey through this and meeting with you guys weekly and weighing in on what's going on.
So how did you get started in weight loss?
So it really started way back. I opened Ultimate Weight Loss Solutions back in August 2009. And I was working with my stepdad at the time. He was an OBGYN. And then he passed away a couple of years later, as when I was paired up with Dr. Gordiski at that time, with you. And so, yeah, and I haven't left since. And so we've just been collaborating and working together, expanding. It really started out with just one program, which was OptiFast. It's a meal replacement diet, which we still have, very popular. So that's another option you could utilize. And from there, we moved into the vitamin shots, the B12, the what we call our ultimate shot. It has a B complex, a fat burn in it. It's a fat burn you might hear out there is lipotropic. It's just 3 amino acids that work with the liver. So we've brought that on, and then from there it went into phentermine, which is another option you have.
And
And
that's a appetite suppressant, right?
yes, so it's part of the amphetamine
Hmm.
family, phentermine. So it will kind of give you that speedy effect, but it does help alongside everything, alongside diet and exercise. It will help you to lose the weight very efficiently. So not for everybody, but it's definitely a good option. So
That's a lot of these are medically supervised, and
Yes,
some are not. But things like B12 shots, OptiFast. Some OptiFast can be non-medical, but some OptiFast has to
right.
be, if it's under 1,200 calories, you have to
I would
be.
say literally over the last almost 15 years, that's the one thing I will say um, is the safety of weight loss. So I know I hear from a lot of you guys out there, why do you have to do blood work? Why does it cost this, that, or the other for this? The reason it's in place is because Dr. Gordiski and myself want to make sure that you are getting the safest and best service. And we mean that all the way down to if it's not going to work for you, if you, because there's a lot of places I can tell you all day long where you can go and they won't run your blood work. They won't even give you a physical. But I don't recommend that. I want to make sure you're safe. If you're in our hands, you are going to get the best service and we're going to take care of you all the time. As you hear, I say, I'm here 24/7 if you need me. So,
Well, a lot of times patients will, they'll be overweight. They don't know why.
yeah,
They'll have tried different things and they failed, and then they just keep trying different things and nothing's working.
right.
But there's a reason. Maybe they're a diabetic. Maybe they have underlying problems that they need to be addressed. So
Yeah,
without doing some kind of blood work, without doing a physical, and if they don't go to their doctor and get it done, at least we'll do it for them.
right.
And if they have issues, we'll have to refer them to their primary physician and maybe a specialist to kind of work it up. But if everything else is going the right way, and we just need a little extra help, then we have the medical options.
Yeah. How many people over the years that have come in and didn't realize they had a thyroid or a heart condition? How many lives have we saved? Really, honestly, forget about the weight loss for 1 second. Just put a pin in that. But how many people that we have helped out in another realm that come back later? This crazy mentality out there a lot of times dying to lose weight. It shouldn't be that hard. It isn't that hard, honestly. I get it, it's a disease. I get all of that. But there's things in place, and like what Dr. G just said is if you have the information in front of you and you have providers like we have here that are knowledgeable, they can guide you and they can really, and that's why we brought the hormone replacement on. That was one of the big reasons we were seeing weight loss is great, but there's a whole other side of this that you're not going to lose weight if your hormones are off. And I'm going to speak to that in one of my episodes soon. About my weight gain that I'm in right now, for sure, due to hormones and life in general. You all know how that is. So yeah, but yeah, you know what it is. You just keep going. You get the information and you do what you got to do. So
So one important thing that differentiates our programs from others is the weekly weigh-in.
yeah, literally,
Literally,
yeah,
not just the podcast, but the actual weekly weigh-in
yep,
that happens. And the reason why we do that, we don't, some place will just give you the meds, you take care of it, come back and see us whenever. But no, we want to see you once a week, and Roseanne will do the weigh-in and kind of go over the issues and see how you're doing and track your progress. So that's a really important part of the whole motivation to keep going with the program and to be successful. And the weekly weigh-ins are
it's
100% part of
very
the
important. Yeah,
part
I
of the
think
program.
so. It keeps you accountable, and also a lot of times you might just be doing. How many of you walked in here and are like, I don't know, I didn't have anything. I went to Starbucks, I got a drink, and then what do? We pull it up on the computer or on our phones, and 63 grams of sugar. I mean, come, you're starting that first thing in the morning, things like that, and then outside of the nutritional value of items, but the psychological, which is where I like to step in. I'm not a nurse per se, but I do like to deal in the realm of the psychology of why we're doing what we're doing and how we're getting to where we're going. So, um, I have my degree, I have my master's in clinical psychology, but I really like to shift over, utilize that, and use a life coaching method more so. I like to get you from point, if you're going to A to C, what's that obstacle? What's the B in between? And how do we get over that? So, um, having that weigh in, having you come in, giving you pointers. My goal every time you walk out of my office is for you to say, oh my gosh, I didn't even know that. Wow, that's some great information. I'm doing my job and getting you healthier than you already are. And that's what I strive to do here. So hopefully,
And the way that this fits into our practice is, a lot of times patients will come in for liposuction or
yeah,
for tummy tucks, my makeovers, and things like that. And they're really just a little bit too overweight. And if your BMI is over 30, potentially you have more risk of surgery, you may have more risk of infections. And sometimes we do recommend for patients to lose some weight before surgery. And so that's why it's such a close relationship with the weight loss programs, because sometimes patients will need to lose the weight first. Now, if they lose the weight and they're happy with the way they look, they can skip surgery. That's not why we're doing this. We're doing this to make them feel better. So
Yeah.
they don't need surgery, great. But if they still have extra skin, or if they still have some trouble spots, we can still address that. But if somebody comes in and says, I want liposuction like here, like half of my body needs to be liposuction, that most likely you don't need liposuction, you need weight loss.
Right. And it seems like that wouldn't even be safe to be just pulling that much fat out that way. And again, back to the safety issue. And yeah, that's really important. Yeah, definitely. Mm, I, s- Not only that, I mean, yes, I'm Ultimate Weight Loss Solutions. I get all that. I'm a business provider. But from the consumer side of this, like why spend your money on why not get the best result? That's all Dr. G is trying to do to get you to a BMI where you are going to see much better results. Save your money, lose the weight, and then go in. You can do surgery then at that point and get a really great result. You can go and do our body contouring with Ellie or Relly are here. So you can do an Eon, you could do a cool tone, a cool sculpting, some forma. So there's so many options. Do you even know how many options there are out there? Because once you guys got to give us a call over here.
Yep,
And
there's a lot of options.
yeah, there's a lot of options
but
out there.
but the thing is, in the past, what I usually would do is just, patient would come in and I would just say, you need to lose weight, save your money on the surgery, just pay a trainer and get some weight
Right.
loss done. But a lot of times patients don't do that and they fail. And I think the whole relationship that develops with the weight loss
Yeah.
program is why they get successful, and then they don't have to go anywhere else. We just, stay
Yeah.
here and do what you need to do, and at the end, we'll get you your results.
Yeah. There's definitely that frustration you hear out there. I went to my doctor and let's all say it together. What did they tell you? Eat less, move more. Come on. Like we don't already know that. Eat less, move more. It's deeper than that.
So when you mentioned that, so when patients want to lose weight,
Right.
and so that's one of the things we kind of talk about, that if your BMI is under 30,
Mm-hmm.
let's say, but you're overweight, and you want to lose the weight and you can't, and you're just kind of gaining weight slowly, but you're not quite there at that threshold, and you don't meet the technical requirements for your doctor to prescribe you those medications to
Right.
help you lose weight. So what do? You just wait until you start getting bigger or
Right?
start getting medical issues, um, or do you just kind of you know just streamline into it? So that's why in our program we don't take insurance for it. It is more of like a cash based program, because we don't have to worry about what the indications are, what the insurance will pay for. So
Right.
if you want to lose weight and you meet the medical requirements that we've established, you can start on the programs before you develop any of those comorbidities, and your weight is out of control. So that's one of the advantages of doing it kind of in our type of setting, as opposed to just going to a primary doctor and getting a prescription.
Absolutely. Absolutely. And back to I'm going to call them GLP-1 medications. You can reference that. That's the Ozempic, the Wegovy, the Mounjaro, the Zepbound, the Saxenda, all of those. So yeah, we're using those fancy scales, of course, up in here. And with that said, it isn't just about a BMI. So a lot of you are athletes out there. A lot of you have a lot of muscle in your body because you lift. So it's not really always about that 30 BMI or a 27 BMI with a comorbidity. We actually will even break that down farther and look at your fat mass. So you may be very fatty, but your BMI, so the way you're falling might not make you somebody who'd be a candidate in the insurance world, but in our world, you will be. And, but again, let me caveat that not everyone is going to get into the program. It is about safety, and we're not putting, you know, people who are not necessarily needing that. So there's other things though. There's vitamins, there's training. We have training sessions available for exercise as well.
BMI is a funny thing, because I mean, I had an experience with a patient that I saw in consultation, and I think her BMI was high, but um, the reason why she wanted to be seen is because she had an actual medical problem. She had a lot of skin and it was irritating and she was uncomfortable. BMI was high. So her doctor refused to send her to a plastic surgeon because the BMI was too high. So he told her you have to lose weight. But the problem is she can't lose weight because she can't move and she's having these issues. So she would get referred. She wouldn't get referred. So she would have to go and go out of network and out of pocket to see basically cosmetically somebody who would treat her medical problem. So sometimes that happens too. So everything has to be kind of looked at from a different perspective, and just have to figure out what's the best treatment. Sometimes you can't just look at the numbers; you have to actually look at the patient.
That's what we say. That's what you say all the time. Yeah, you got to look at the whole patient and assess it from there. And that's why I think that's why we're so successful in, with the patients we're seeing, because it's a whole person. It's not just a symptom or something like that. So
Oh,
yeah.
so what else are we doing any more of the lumen?
Oh,
What,
yes, actually, we have the Lumen. We were just running a special on that, actually, where we're, so yeah, give me a call.
what's the lumen?
Oh,
What do we do?
what's a Lumen? Bam! Let me tell you what a lumen is. So a lumen is a device. It will, if you're familiar with that world of vapes, it looks like a little device, and you blow into it. It connects with your phone, and it'll register if you're burning fats or carbohydrates. And at that point, it will guide you, and it'll tell you what you should be eating, or what you should activity you should be doing, things like that. So it's good. It's not meant to keep you in a state of ketosis, meaning that you're staying.
Well, I think the point is it helps to guide your weight loss.
Yes, it has metabolic flexibility, is what it
Exactly.
is.
So if you're having difficulty losing weight and you don't know why, this will kind of give you the feedback that
Yeah,
okay, the reason why you're not losing weight is because you're burning mostly carbs. It means your body has a surplus of carbs,
right.
which means that if you're not gonna get out there and do a good workout, what you're probably gonna do is start depositing fat. So if you are, and this basically gives you that answer. See if you're adequately worked out, if you're adequately nutritioned, if you need to get moving, or if you're ready for a meal or protein meal. So this is a good kind of a feedback way to know where you stand and helps you guide you on your way with the weight loss. So it's like another aspect that we can offer that a lot of places don't have. It's just like you just kind of guess, okay, I lost a pound or I didn't. I don't know what happened, but this will actually tell you why or why not.
Yeah, it's been a great resource, I would say. If you've gone through a program and you're gonna be out there on your own, this is great to have going through a program. When I did the GLP, I did tirzepatide. It was interesting because I could not come out of a carb side of it. I was never burning fat. I couldn't figure. I mean, I couldn't figure it out. I could figure it out, but technically I started the tirzepatide. It ranges 1 to 5, 3, 4, 5 being you're in a carb state, and 1 and 2 you're burning fat. When I started that medication, it was 1 and 2 the whole time it was crazy. Interesting, because then it really kind of shows you that you are burning fat, that the medication is doing what it says it's doing. So that was really insightful, actually, to utilize. And I'm still, well, not using it right now. Let's see. We have the tools available to us if we have to use them.
You should go to the weigh-in with Ro.
Yeah,
She'll put you
right.
on track.
She's going to get me on track. Yeah, no, absolutely. And we'll talk about that stuff in there, about how uh,
How
it's
to
like
stay
with
on track.
how to stay on track. And there's never a good time. Never a good time to have a baby. Never a good time to fix your house. Never a good time to lose weight. Never a good time to go back to school. Never a good time to get in or out of a relationship. You know what? The good time is now. The good time is here at West Coast Plastic Surgery and Ultimate Weight Loss
It's always a good
Solutions.
time.
It's always a good time. Ain't no party like a West Coast party.
All right. Well, with that, we'll conclude our podcast today. And thank you, Roseanne.
Thank you
And
so much
we'll
for
keep seeing
having
you
me here.
around. And then stay tuned for the next one. And we'll see you then. Stay beautiful, Oxnard.